chat, and Margaret and I will read them to Dr. Phillips at the end. And then last thing, we are going to record the session. So if you don't want your face to be seen on the recording, just make sure you turn off your camera. But Dr. Phillips, thank you so much for being here today. I'll go ahead and hand it over to you.
I'm muted. No problem. Thank you all for having me. This far into the pandemic and I still haven't figured out Zoom is embarrassing. But my name is Mike Phillips. I'm one of the pediatric surgeons. I'm just going to share a pretty simple PowerPoint presentation, but just to help me like sort of remember the things that I wanted to talk to y'all about today. And the one caveat here is that I have a surgery to do in a few minutes, and so I might get pulled away, but hopefully I can be back quickly or be done before. I'm really excited about the opportunity to chat with y'all. This is my sort of background. My name is Mike Phillips. I was born in a small town in southeastern Utah and moved to Salt Lake when I was very young. I grew up there. I played sports. I didn't really do much in school. And then after my high school years, I spent 2 years doing a service mission for my church. And that's sort of where I decided that I wanted to pursue medicine. I learned Spanish as part of my time, and so I spent a lot of time translating for people in medical settings, and it sort of gave me this idea of what medicine looked like from a casual observer. You know what I mean? Because I'd been to the pediatrician before, and I liked the guy. He was nice enough, and he gave me stitches whenever I cut myself, but I didn't really have a sense of what doctors did beyond that. And so this really in a variety of settings let me know okay, you sit with people and it's mostly about teaching them about their health, and it really makes a big difference in their life. And even if you have bad news, they're usually happy to just have more information. And so when I finished, I decided that medicine was something I was interested in, and so I went to Brigham Young University for undergrad. I did a degree in microbiology. I did all the things that all of us pre-meds do. I shadowed in the ER. I shadowed a radiologist, and I did lab work and all of those things. And I think the thing that was, impressive to me there was just, I really felt like even not knowing what I wanted to do, all the things that I'd been exposed to in medicine were exciting to me. Translating, volunteering, shadowing, because they all sort of give you a different idea about what different specialists do. And that even though I didn't know what I wanted to do, there were enough things in medicine that were appealing to me that it felt like a good career option for me. And so I applied to medical school like we all do, and interviewed and was lucky to be accepted to the Medical College of Wisconsin in Milwaukee. And so I went there for 4 years. They had a research track for medical school, and so I did an honors and research program that was essentially just additional research time, and you had to write a thesis. And I enjoy research, so it's something that I pursued. And I tell you all these things just so you sort of know what my background was getting into the career that I got into. And then if you have any questions about those specific things as well, to sort of give you a jumping off points. But I was lucky to match into general surgery residency at UNC and have loved Chapel Hill. I started residency in 2009. And I did a 7-year residency. So general surgery is a 5-year residency. And I took a 2-year break to do additional research, and I did basic science and clinical research for 2 years, and really sort of cemented my interest in doing clinical research. And so when I finished residency, I was lucky to match into pediatric surgery at the DuPont Hospital for Children in Wilmington, Delaware. Pediatric surgery is our hardest subspecialty to get into, just because there's always more applicants than spots. And then when I finished there, I was lucky to get a job back here on faculty, and have been here since 2016, I guess. Is that right? Nope, 2018. And so my academic interests are clinically, I do a lot of the prenatal counseling for moms with congenital anomalies related to pediatric surgery. I have a big interest in minimally invasive surgery, and then I do almost all the inflammatory bowel disease surgery here. And then congenital anomalies, I think, are what people associate with pediatric surgery when you hear about pediatric surgery. And so that's sort of where my passions lie. For research, I have a role in the information services department. So not infrequently, I do work with our electronic health record, as well as other ways that we use electronic data to take care of patients. And then my big interest there is how we use that data to make decisions as surgeons. And so clinical decision support is sort of my area of interest. And as part of that, I'm doing a master's in clinical research in the Gilling School of Public Health in my spare time. So my typical week, and I just do this just to sort of give you all some background. There are 5 pediatric surgeons at UNC, so we're all on call about once every 5 weeks. We cover about a week of that, and we break our blocks up into Monday through Thursday, and then Friday, Saturday, Sunday, so you're not on for 7 straight days. When I'm on call, there are residents in the hospital who see surgery consults, and then they staff them with me, and then I go see the patients after the residents do. I do scheduled surgeries even when I'm on call, and then we take care of the trauma and acute care things that come in, appendicitis, things like that. And then we also are on the team that connects people to extracorporeal membrane oxygenation, which is an extracorporeal life support device where you make an incision in their neck and put big IVs in to drain blood, add oxygen, and then return it to the patients. When I'm not on call, like this week, I do my academic and committee work. And so I'm the NSQIP, the National Surgical Quality Improvement Program, which is through the American College of Surgeons. I'm the quality improvement champion for pediatric surgery. And then I'm on a number of committees within the hospital related to quality. I do my academic work in my master's degree, and then I have an OR day every Wednesday and then a clinic day on every Friday. And so in a typical day, this was my last Wednesday OR day. I had a infant that had a tongue tie, so his lingual frenulum, the connective tissue that keeps your tongue in the bottom of your mouth, it usually stops about mid-tongue, and his persisted, and it's a common condition to persist all the way to the tip of the tongue, and so they can't lift their tongue, and so it can lead to speech impediments. In his case, it was causing difficulties with latching during breastfeeding or using a bottle. And so I just incise that and cut it back to where his tongue is free, and then hopefully can take a bottle better and feed better. We do a lot of gastrostomy tubes. If you look at the most common surgeries pediatric surgeons do, it's like number 3 or 4. And there was one that needed to be revised. The site had become poorly healed and just needed a little bit of love. And so I did that. And then I did a pull through for Hirschsprung's. Hirschsprung's is a disease where the nerves don't form correctly in the infant intestines, and it usually it affects the last part of the intestine and works back. And so to fix it, you have to resect the most distal part, the last part of the intestine, and then pull through the normally innervated bowel. And so I did that for a 3-month-old. And then Thursday I did a colectomy, and I added on another gastrostomy tube, and I was not on call last week. I just got lucky. And then Friday I did another colectomy, which just means I removed a child's colon. And I did all of these laparoscopically, so through small incisions, long instruments, and a camera. And then on Friday, I had 19 patients in clinic. I saw a lot of different things: umbilical hernias, inguinal hernias. I saw a kid with chronic intestinal dysmotility, excuse me, related to cerebral palsy. I saw a kid with biliary dyskinesia, meaning their gallbladder just doesn't function correctly. I saw a mom who I'd seen prenatally whose fetus was diagnosed with a congenital pulmonary abnormality. and the baby had been born, and so I was seeing them in follow-up. I saw a kid with pectus excavatum where the sternum is aimed inward, and is a chest wall abnormality. And then I saw a couple of patients just in post-op follow-up and did some counseling related to that. And so sort of um, I think one of the things that I really like about pediatric surgery is that you see a lot of different things that affect a lot of different body systems. And you see patients from fetal development all the way through adolescence and even young adulthood. And so it gives you a lot of exposure to a variety of pathology, and it really makes things fun. So that's sort of my 12-minute spiel about pediatric surgery. I'm happy to answer any questions y'all have.
So we can go ahead and get started with questions if you're good with that. The first question is, what is the most exciting or interesting surgery you've ever done?
My favorite surgery is we fix a lot of congenital abnormalities. One of the, I think, just most interesting from a physiologic standpoint is congenital diaphragmatic hernia, where you're born with the absence of a complete diaphragm. And so your abdominal contents move into the chest and they compress your lung during development. And so these kids are frequently born with underdeveloped lungs and hypertensive lungs. So they get bad pulmonary hypertension. And so those children will sometimes require ECMO cannulation. And so to go on ECMO, you have to have your blood thinned so that it flows through the circuit. And so then putting babies on ECMO and then fixing their congenital diaphragmatic hernias is sort of my favorite thing to do, because it's really sick kids with really complex physiology and complex decision making around the repair of their hernia. And so it's really technically challenging and clinically interesting. And so that's my favorite thing.
Awesome. Thank you so much for sharing. Our next question is, how was life-work balance during residency?
I think that the way that I sort of describe residency is you don't have time to do everything. And so you prioritize the things that are most important. I got married during residency. We had our first child my last year of residency. We had one more child during fellowship, and then we've had one since I finished. My wife's also a physician. She's an anesthesiologist. And so we feel like we've had really good work-life balance and have been able to make things work. I don't go to nearly as many sporting events as I did when I was younger, and as I would like to someday, but it's because I'm spending time with my wife and kids and doing things that I really think are important. And so it's something that if you prioritize, you can do whatever it is, whatever your sort of priorities are.
Thank you so much. Our next question, this is slightly broader, but what is your favorite part of your job?
It's tough to say. I don't know if there's one specific thing that's my favorite, but I think the thing that I like best about it is the variety. And so it's really like that there's a lot of things I like about it, if that makes sense. Not There are some surgical specialties where you really get sort of focused and you do hip replacements every day, and you do 3 hip replacements a day, and the next day you do 3 hip replacements, you know what I mean? And I think being able to operate in the chest and the abdomen on kids that are newborns to kids that are adults is really, I think, my favorite thing about it.
Awesome. Thank you so much for sharing. Our next question is, what did your research fellowship focus on?
I did 2 years of basic science research. So I did research in undergrad in a cancer lab, and then I did research in med school, also in a cancer lab. And so in residency, I wanted to look at some different things using those same techniques. And so we did research on pulmonary vascular development and congenital diaphragmatic hernia. And then on the side, I would do clinical research too, related just to pediatric surgery primarily. But our lab work focused on factors that influenced timing and development of pulmonary hypertension and CDH. And so I developed a mouse model, and then developed a protocol for separating endothelial cells from the underdeveloped lungs.
Wow, thank you so much. Our next question is, what was the longest surgery you have ever been in so far?
Um, when I so I think when I was in residency, I did one that was 16 hours, um, but it was atypical and not something that I like. I like shorter surgeries. That's one of the things that's good about pediatric surgery. If I'm doing a surgery that's more than 3 or 4 hours, then something's not right. So these are more straightforward cases.
Thank you for sharing. Our next question is, how has COVID affected your practice?
um, it has and it hasn't. It's a lot more, I think, protocolized around the way that we actually get to see patients face to face, but people haven't stopped having babies, and babies haven't stopped having congenital anomalies or appendicitis. And so a large majority of what we do is actually acute care surgery. And so it's not like we can put off appendicitis, or we can put off having your diaphragm fixed if you're an infant. And so our volumes actually in pediatric surgery have been pretty steady, but there's a lot more rigmarole into making sure patients don't have COVID and you're not exposed, and a lot more PPE, I would say.
Thank you for sharing. Our next question is, if you had to do it all over again, would you become a physician? And I guess to add on to that, would you still become a pediatric general surgeon?
Absolutely. Yep, that's easy. I love what I do. It's hard work. I still work 60 to 80 hours a week, um, but I love what I do and I love my patients. So absolutely.
That's really nice to hear. Our next question is, have you ever had difficulties with the insurance company?
My own or somebody else's?
I'm assuming somebody
I'm
else's.
just teasing. Nothing that like comes to mind. There's always a ton of paperwork with the insurance companies or with the federal government that supports Medicare and Medicaid. And so as long as you do the paperwork, it's usually fine. But I haven't personally had, other than the run of the mill BS stuff that you deal with and everything.
Thank you. Our next question is, what advice would you give to your younger self now having arrived at this point in your career?
I don't know. I think that for me, it's sort of, I think it can, surgical training can be daunting. It can appear difficult. And a lot of people try to talk you out of it. Oh, that's too much work. Oh, you won't have time for a wife or family, or whatever your interests may be. You won't have time for it. And I think, life passes regardless, and you're going to be 20 years older in 20 years, whether you do what you love or you do something else. And so if you love it, it's worth the investment. If you don't, find something that will make you equally as happy. But I love what I do, and so it's been worth it for me.
Yeah, that's really good advice. Our next question is, do you have any plans for the future career-wise? Like, do you have any goals, etc.?
Just take good care of children, and I think my research passion is for improving the care of children, and so trying to give them the best outcomes, and with the least morbidity, I think is where I hope to focus. And so that's sort of, I just want to work at UNC and take care of the babies the best we can.
Thank you so much. Our next question is, how much of the surgeries you perform are endoscopic or minimally invasive?
I try to do minimally invasive whenever I can. And I think for most procedures, we have pretty good minimally invasive options. And so I'd say it's probably 80-90% of what I do.
Very interesting. Thank you for sharing. Our next question is, how do you think predictive informatics will change medicine in the future?
I hope that it changes it a lot. I am not hopeful for any of the technology we currently have available to do that, because I think that there's too much clinical variation, and the data that we have aren't great in terms of making good algorithms. I think if you've looked at any of the AI stuff around radiology and reading films and under-resourced areas, the outcomes are pretty lackluster, especially for complex things. And so I think in the same way we'd never anticipated laparoscopic surgery 10, 20, 30 years ago, I just don't think that we have a picture yet of what that's going to look like, but I'm hoping that it's very helpful and makes some paradigm shifts.
Awesome. Thank you. Our next question is, was there something you wish you knew more going into medical school, such as preparing for the journey?
Not really. I mean, I think getting as much exposure as you can before you invest in applications and travel and all that stuff is good, just so that you really know that that's what you want to do. Once you get there, it's like everybody's journey is different, and whatever it is for you will be different than it was for me. And so I think as long as you have a passion for it and you know that you love it, you'll figure out all the other stuff.
Thank you. Our next question is, how much paperwork do you have to do during each shift?
Almost all of it's not on paper anymore. It's usually all electronic, and it varies. We don't have shifts in the strict sense of we see 10 patients per shift or whatever. We're just on call during a certain amount of time, and so if you get 100 patients or 10 patients, you have to write a note on all of them, and so it just depends on how busy you are when you're on.
Thank you. Our next question is, what is one surgery event that really shaped your view on medicine?
Um, I'm not sure uh, what the what you're asking. If you're asking sort of what got me interested in surgery, or how I think surgery affects patients. If you clarify, I'm happy to answer. But for me, I think that the thing that sort of got me interested in surgery was I did trauma surgery when I was a third year medical student. And my sort of primary exposure before that was mainly my pediatrician. And so I didn't really have surgery as something on my radar until I did it. But really enjoyed sort of the rapid change that people get when they have surgery. It's sort of instant gratification. You really fix something or you don't. And so I liked that aspect of it. And then I liked the technical, like doing stuff with your hands aspect of it that made it interesting to me. And so those were the things that sort of made me interested in it as a specialty.
Thank you so much. Our next question is, for the person who know he/she wants to go into surgery, would that be beneficial to apply to specific medical schools?
No, not really. I think, you can get into surgery or a surgery subspecialty from whichever medical school you're able to matriculate to. And I think as long as you do well there, and do well on your standardized exams, that's really what people are looking for. And I think the exact medical school is less important ultimately.
Thank you so much. Our next question is, how do you deal with getting sued as a surgeon?
It's sort of a tough question. It's always a difficult thing to sort of think about. I think that you try to do the best job you can, and you always hate it when that doesn't come through in the patient outcome. And I've not been sued personally, but I've had lots of complications as a surgeon, and I think we all do. I think it's part of what you accept when you pick this as a career. And so I think trying to figure out how you are going to personally deal with those is an important part of your maturation process and developing and training. Because if you haven't had a complication, you just haven't done enough surgeries. And so eventually it will happen. And then you have to sort of help the family get through it, and help your patient get through it, and help yourself get through it. And that's something that you just have to learn as you go.
Thank you so much for sharing. Our next question is, what is your least favorite part of your job?
Um, I think the administrative part is just annoying sometimes, a lot of notes and documentation, I guess, but it's also necessary. So I don't know. That's probably what I would say.
Thank you. Our next question is, how do you deal with failure in your profession? And then to add on to that, how much do you feel mental health problems affect general surgeons?
Um, it's a good, it's interesting. I think that, if you look at surgeons as a sort of specialty choice, I think we tend to have higher, unfortunately, mental health problems than other people. I think rates of like drug and alcohol abuse are higher, rates of divorce are higher, rates of suicide, unfortunately, are higher. And I think part of that is different for everybody. And I think that I don't have the right answers. I can tell you what I've done for me, but that doesn't mean it's the right answer for other people. And so I think just being aware of it and then figuring out for yourself how you're going to deal with those things, or how you deal with those things, or how you recognize colleagues that might need a hand dealing with those things, I think are things that will be part of all of our training as we go forward.
Thank you so much for speaking on that. Our next question is, have you ever run into problems with getting too close to patients? Do you feel like you have to detach yourself emotionally from your patients?
I think you guys are all caught up on Grey's Anatomy. Um, I don't ever feel like I can get too close. Like I always want to try to put myself in their shoes and like empathize with them, and especially as a parent, like what they're potentially going through when they see their kids go through something difficult. But I never want to feel like I have to detach emotionally from my work or my patients, because part of what my patients get when they see me or bring their kid to me is somebody who's going to be invested in them emotionally, um, and I think that they deserve that. And so it's not something that I've had to deal with, luckily.
That's great. Thank you so much. Our next question is, do you think it's necessary or do you recommend becoming a certified CNA or EMT to get exposure?
I don't know. I think, my answer historically would always be no, because it's a lot of work, and then it's a lot of work while you're trying to do a lot of other things. And nothing is truly necessary. And you'll find that as you go through medicine, like there are people from all different backgrounds and all different walks of life and all different training paradigms. I think if you're interested in that and it's fun for you, then go ahead and do it. But I think you can get enough exposure volunteering or shadowing, at least historically, without doing those things. And I don't know what that looks like in terms of COVID 19, and how that will change things or how long that will be with us. But I don't think that it's necessarily to do that unless you want to.
Thank you so much for sharing. Our next question is, how old were you when you became an attending surgeon?
I was 37.
Awesome. Thank you. As of right now, we don't have any more questions. So if anyone has any, feel free to put them in the chat really quick.
But we know you're super busy, so if no one has any more questions, we can go ahead and let you go. But we're just gonna wait a minute because we really appreciated hearing from you today.
No, thank you guys. I thought those were really, honestly, very thoughtful questions, and I think really mature too. And good luck to all y'all in COVID. And if I can do anything to help anybody, I'm happy to put my email in the chat too, and just shoot me an email and let me know.
Well, yeah, it doesn't
Go.
really seem like anyone else has any questions. Oh, wait, we have another one. We have a question. Okay. Our next question is, when it came to you having children, how did your work respond with?
I think that they were supportive of me taking time off, and I think that all the surgery programs have a minimum number of weeks that you have to complete to graduate from your surgical training. And so I think if um, if you take extra beyond your allotted time off, you just have to make them up. But the program itself was very supportive, and whether they are or they're not, there's a baby coming. So
Here, we can do one more question since we can kind of close out after that. But do you and any of your colleagues still have undergraduate students shadowing at this time?
Not right now, I don't think.
All right. Well, thank you so much for speaking with us today. Good luck on your surgery.
Okay. Thank you guys.
Yeah.
Thank
Thank you
you.
so much.
You're welcome. Bye.
Bye.